My name's Tony Riccio. I'm the director of the Center of Excellence for Foot and Ankle here at Texas Scottish Rite Hospital for Children. And first and foremost, let me say congratulations. The fact that you're watching this video means you're about to have a baby, and that's fantastic news. I see my role today as that of an educator to teach you about our philosophy for treatment of children with clubfoot deformity here at Texas Scottish Rite Hospital. And hopefully in teaching you about how we take care of these children, it will ease some of the anxieties you might be feeling with regards to what's going to happen over the next several weeks, months, or even years. I tell all parents that the most important thing you need to know about a clubfoot is that a clubfoot is not a normal foot that's just twisted and turned into an abnormal position. A clubfoot is a true congenital difference. There are structural differences inside the foot that create the outward deformity and appearance that you see. And what we mean by congenital differences is that the shape of the bones is not the same as your foot or my foot or a child with a normal foot. The elasticity of the soft tissues is much less than in a child with a normal foot. And the reason I tell you all these things about all these congenital differences is because our method of treating club feet can't alter any of them. We can't change the shape of the bones. We can't improve the elasticity of the soft tissues. We can't change the way the blood vessels move into the foot. And we can't change the power with which certain muscles fire. And therefore, the goal of treatment of a clubfoot isn't to create a normal foot. The goal of the treatment of clubfoot is to take this structurally abnormal foot that's in an abnormal position, and through a series of casts that are applied weekly, turn it slowly into an abnormal foot structurally that's now in a near normal or completely normal position, while limiting the need for surgery, which creates scarring and stiffness, thereby preserving as much motion to the foot as possible. The truth of the matter is we don't know, even with everything we know about how to treat clubfoot, exactly why a clubfoot occurs. What we do know is that club feet are present in 1 in 1,000 live births, and that's a lot of children. It's a very common deformity, and we take care of hundreds and hundreds of children with clubfoot at Scottish Rite every year. Although genes have been identified that are associated with the clubfoot deformity, it doesn't appear to run in families with any identifiable pattern of inheritance. So I don't want you to have any anxiety that this is going to be an ongoing problem that's going to run in your family. And more importantly, please understand that this clubfoot has nothing to do with anything that you as a mother or father did or brought to the makeup of the child when the child was conceived. As a parent, you'll notice certain differences in the foot following treatment. A clubfoot is always smaller than a normal foot. Sometimes they wear different size shoes, maybe half a size or a full size different. And the difference doesn't stop at the foot. Even the calf musculature of children with clubfoot tends to be thinner. Their calves are small. That being said, if the foot sits flat to the ground, has as much flexibility as possible, the child can wear any shoes they want, play any sports they want, have any job they want, and do whatever they want with the foot. To them, it will function no differently than a normal foot. And that's ultimately our goal for treatment, that this clubfoot never limits your child in any way whatsoever with anything they want to do. We employ what's called the Poncetti Method. The Poncetti Method involves applying casts to the foot once a week, with each cast designed to correct a different component of the clubfoot deformity. We can use these casts to correct every component of the clubfoot deformity with great success save for one component of the deformity, which is a contracture in the back of the ankle, tightness of the Achilles tendon, if you will, that tends to keep the foot held down in a pointed down position. Therefore, most children need a small procedure that we do in our clinic under local anesthetic without the need for any general anesthesia at all, where we take a teeny tiny blade, a blade that's actually used for eye surgery and isn't much bigger than a needle that would be used to draw your blood if you went to the doctor's, to percutaneously, by feel, actually transect that tendon, cut it in half, which lets us acutely bring the ankle up into a more normal position. And we hold it in that position in a final cast that stays on for 3 weeks. On average, it takes us about 4 weeks of casting, with one cast applied a week, to get these feet from an upside down and turned in position to a right side up and turned out position. At that point, if the foot is stuck pointing downward, we do the heel cord procedure and put on a final cast for 3 weeks. So our total average time in cast is about 7 weeks. It's very important to understand that casting is just the first part of treatment of a clubfoot deformity. And so it's really important that once we remove that final cast, we do something to keep the feet in the position we've achieved. And this is really the most important part of the clubfoot treatment, and it involves using a special type of brace to keep the feet pointed up and outward. The braces look like silicone shoes. They're very soft on the inside with suede straps over the top. And the shoes are connected by a bar that help keep the feet turned outward. We have to have shoes on both feet, so even if your child just has a clubfoot deformity on one side, they will have the shoe on the other side, because we need to brace the clubfoot against a normal foot to keep it held outward. The braces need to be used 23 hours a day, and that's a lot. Most of our parents take them off 30 minutes in the morning, get the children ready for the day, do some feeding, some cuddling, some playing, and then they go right back on. They're on all day, and then they come off for another 30 minutes at night for some bathing, some feeding, some cuddling, put on pajamas, braces go back on, and they stay on all night. And we use the braces 23 hours a day all the way up until our children start to pull themselves up into a standing position. The braces won't interfere with your baby's ability to sit up, to roll over, to crawl, or even to stand. It's just that once they pull up to a standing position, they're telling us they're getting ready to spend more time on their feet, and then they'll use their own body weight to help keep their feet to the ground. Until that time, they'll be spending most of their time lying down and sitting, at which point the feet are held in a relaxed position, and those heel cords that we took care of with autonomy can tighten back up. So once the child pulls to stand and begins to walk, the shoes will come off during the day, and we transition to nighttime brace wear, and the braces will be used 12 hours every night. And we do that all the way up until age 4. So the braces will be a very big part of your life and a very big part of the child's life in their early years. But they are absolutely critical, and they have to be used the way they ask for the treatment to be successful. We know that if the braces aren't used the way we ask, or used at all, the risk of recurrence of the deformity approaches 100%. And club feet are much, much more difficult to manage in older children than in very young children. The bracing is most difficult for the first couple weeks after the child comes out of their post-anatomy casts. After 7 weeks of being in casts, it's like the baby's feet have been in little personal isolation chambers. No one's touched their feet. They're just used to the cast and the cotton inside the cast, and they just don't appreciate having anything else touch their feet because it's not normal to them. When we go into the braces, that feels different, and they won't like it. It won't be painful, but it'll be frustrating to them. And that's the hardest time for the parents, because naturally, unlike the cast, the braces can be removed at home. It's important for you to understand that if the baby cries and you remove the braces because they cry, like any other creature, they quickly learn that if they cry, they'll get what they want and the braces will come off, and then they will continue to cry. If you're very strong during those first few weeks and you keep the braces on, just like the cast, the babies will get used to the braces and it won't be a problem after that. But we're going to help you all along the way once we get to that point. I'd love to tell you it's 100%. I'd love to say, yep, if you use the braces, that's it, we'll be done. Unfortunately, because this is a structural congenital difference, there is a certain percentage of children who, regardless of everyone doing everything right, still have some relapse and some need for further treatment. Our own research here at Scottish Rite would tell us 80% of kids never need any additional treatment. However, despite everyone's best efforts, when everyone does everything right, 20% of children still need some additional treatment. So your next question is, how soon do we need to get started with treatment? What we ask is that you enjoy the baby for a day or two, get home from the hospital, take a breath, get yourself settled, and maybe the day after you get home, just give us a call. Give us a call at the hospital and tell them you had this prenatal visit, and we'll get you into our next clubfoot clinic. Ideally, we begin treatment within 1 or 2 weeks of life. But don't feel like you have to rush over here. We've got plenty of availability in our clubfoot clinics to get your child in, and we'll make sure, as long as you let us know the child's here, that we'll get to them and start casting before 2 weeks of age. We actually have a whole cohort of parents who are very interested in helping parents of an infant who was born with a clubfoot to better understand it and to share their experience. And so just let us know if you'd like to pursue that and we can arrange it.